Hello, my name is Brittany Singh, and today I'll be presenting my signature assignment on leadership and ethics for advanced practice nursing. My presentation begins with a group of 4 members of the healthcare interdisciplinary team. Megan, a charge registered nurse, Mario, a registered nurse, Kenny, a nurse practitioner, and Flora, a case manager, who are meeting to discuss Ms. Jones, an elderly stroke patient who is medically stable and needs to be discharged according to her insurance coverage. However, due to her stroke, Ms. Jones' right hand is impaired, and therefore the team faces an ethical dilemma in determining the best course of treatment for Ms. Jones. Communicating with each other as they work through this ethical dilemma step by step, beginning with the ethical principles of benefits and autonomy to financial aspects, hospital discharge policy, and outweighing the risks and benefits while keeping the patient's needs and safety maintained, the team was able to finalize a plan for Flora to relate to the patient. The ethics theory that was mainly followed throughout the scenario was utilitarianism. Utilitarianism is a consequentialist theory that determines mortality based on the outcomes and interventions. This principle asserts justification for an action that is decided upon the outcome that would bring the greatest benefit after viewing the consequences. The principle of benefits is the duty to do good and prevent or remove harm. It is one of the basic principles that guides healthcare professionals, including advanced practice nurses, in promoting the well-being and best interests of the patients. Referencing back to the scenario, some of the medical staff members expressed their opinion about allowing the patient to remain in the hospital to afford the patient's caregiver additional time to make arrangements for the patient to receive rehabilitation benefits, whether at a facility or in-home care. The other members focus on the patient's risk of contracting an infection due to a prolonged and unnecessary stay, as well as the financial burden it would impose on the patient. Although it appeared the medical staff genuinely were concerned about the patient, it appeared as if there had not been any discussion with the patient to inform her about options regarding her care and treatment so that she could make an informed decision and express her wishes based on the options. While benefits is important, it must be balanced with the patient's autonomy. To assist the medical staff members in making a decision, an ethical framework approach that can be used is the casuistry approach. Casuistry is an ethical framework that relies on case-by-case reasoning and draws from previous cases to guide decision-making of complex situations such as this case. Utilizing this approach helps the medical staff members organize the case into 4 categories, i.e. relevant medical indications, patient preferences, quality of life, and contextual factors such as caregiver and finances. Understanding the patient's medical condition and background outside of the hospital permits medical staff members to arrive at an ethical decision based on key characteristics from prior cases similar to this one, provide awareness to help to attain strategies and approaches to strengthen discussions while prioritizing the well-being of the patient. Breaking down the financial management of the scenario, insurances such as Medicare, Medi-Cal, PPO, the benefits of them are that it covers essential health benefits critical to maintaining health and treating illnesses and accidents while protecting from unexpected high medical costs versus someone paying out of pocket. However, the burdens of insurances are the insurance policies on how long they cover for hospital stays. In the scenario, Ms. Jones' insurance only covered her for a 3-day hospital stay. Not only does this put stress on the patient because she is not just thinking about her health, but rather finances to pay for her well-being, this also places stress on the medical personnel who may feel they have to expedite the patient's treatment to accommodate an early release. The fee-for-service model pays healthcare providers based on individual services provided. This model is volume-oriented that creates financial incentives for healthcare providers and hospitals to perform more tests, procedures, and services on patients since they are paid for each one. This model, however, may not equate to better patient outcomes, but to the contrary, leads to overutilization and unnecessary medical interventions. In contrast, the value-based model focuses on paying for high-quality, efficient care that improves patient outcomes and promotes preventative care. This model is designed as a way to align incentives to deliver better healthcare outcomes at lower costs. The payment model I believe is most efficient and beneficial to patients, healthcare professionals, medical institutions, and insurance providers is the value-based model. The value-based model focuses on improving the quality of care, enhancing patient satisfaction, and promoting preventative care. It has a patient-centered care approach and encourages providers and practitioners to deliver high-quality care. In turn, insurance carriers and the insured benefit from achieving positive patient outcomes through reduced costs because of better hospital and preventative care and reduced hospital readmissions. Taking into consideration the risks and benefits of the situation as a whole, for instance, the patient had been medically cleared, the patient has family support, the hospital stay was covered by insurance, and the patient's safety would not be compromised upon discharge. Megan and Kenny made valid points to the medical leadership team with regards to discharging the patient. Utilizing the casuistry approach to help guide the interdisciplinary team into identifying the ethical principles of benefits and autonomy, they ensured that the patient's goals and concerns were prioritized throughout the decision-making process. The medical team also communicated that they would work with the patient's insurance to ensure coverage so that the patient would not be financially burdened. Balancing these factors while advocating for the patient's best interests can be challenging, but it is essential for providing high-quality patient-centered care. The scenario demonstrated communication, collaboration, and critical thinking skills well when facing an ethical dilemma and formulating solutions in an ethical way. If I was in the same position, I would have handled this situation similarly. The patient is always the primary focus, and as an advanced practice nurse, I have the duty to assist them in any way I can. Effective communication, collaboration, and critical thinking skills are vital for nurse leaders when making decisions about the clinical pathway for each patient they interact with, as well as looking at the hospital's position. Before making any decision, I would analyze the situation thoroughly, noting if there are any ethical dilemmas present. I would then identify the points of view of my colleagues, gather resources that are evidence-based, and reach out to more knowledgeable personnel such as social workers and case managers for assistance. Formulating a plan that places the patient first at all times is essential prior to implementing the plan. Ultimately, the patient and their family are the final decision makers, while the medical professionals remain objective when discussing ethical and moral dilemmas and financial alternatives at all times, putting the patient's well-being first. A policy that I would like to reevaluate is the communication and coordination portions in discharge planning. Discharge planning often involves multiple healthcare disciplines, including physicians, nurses, social workers, pharmacists, therapists, advanced practice nurses such as nurse practitioners, and nurse educators. It is essential to ensure that all team members are on the same page, as miscommunication or gaps in coordination can lead to patient safety risks, delayed discharges, patient dissatisfaction, and hospital readmission costs. In improving communication when there is a language barrier, utilizing translators either through the Stratus or an in-person certified translator when going over discharge planning with the patient along with discharge instructions will help aid the medical professionals in making necessary changes that can accommodate the patient's needs prior to discharge. It would also help the discharge education portion for the patient in ensuring that the patient fully comprehends how to self-manage their condition at home, whether that is lifestyle changes, making follow-up appointments, and attending the appointments. In addition, if there is no language barrier, ensuring that the patient and their family has a complete understanding of the discharge instructions by utilizing teach-back methods. As medical professionals coordinate resources and referrals for the patient prior to the discharge, a problem that arises is attending the follow-up appointments, many times due to transportation. Similar to the scenario, Ms. Jones would have difficulty attending outpatient rehab simply because of her inability to drive. Providing transportation services to ensure patient safety and getting to their follow-up appointments is essential in maintaining patient-centered care approach after discharge. In order to make this change, I would utilize the Appreciative Inquiry Leadership Model, also known as AI. The AI model utilizes a positive and strength-based approach to change management that focuses on what is working well and aims to build upon those strengths. Proposing and leading collaborative effort for enhancing patient discharge planning are followed with this model by the following steps. The first one is discover. Gathering diverse group of healthcare professionals involved in the patient's discharge planning, including nurses, physicians, social workers, and case managers, by coming together in a meeting to discuss what has worked well in current discharge planning processes, while including the strengths and assets of that team. Next is dream. So we're envisioning the ideal patient discharge planning process by collectively setting goals and creating a shared vision how we want discharge planning to look like in the future. Streamlining communication channels, setting specific roles and responsibilities, improving information sharing can assist in arriving at that intended goal. The next one is design. Creating an action plan based on the shared vision. Identifying the specific changes to discharge planning processes, such as introducing regular interprofessional meetings, implementing standardized documentation tools, and enhancing the use of the electronic health records for information sharing. The last step is destiny, implementing the proposed changes in a pilot program while closely monitoring the outcomes, seeking feedback from patients and team members, therefore using the feedback and data to refine and improve the changes. In conclusion, I wanted to leave this personal phrase. Guided hands and sincere hearts of nurses care for their patients every day. As a nurse and soon to be advanced practice nurse working in the medical field, I am privileged to see the transformation of patients' lives by the medical care they receive. The collaboration with fellow healthcare professionals and continuous opportunity for learning make my career as a future advanced practice nurse truly rewarding. Despite the challenges and obstacles in healthcare, my dedication to improving patient outcomes by providing compassionate care ignites my passion for this profession. Thank you for listening to my presentation. The next slide is my references.